Concussions. We've all heard of them, whether it's from sports, the news, or even your doctor. But how much do you really know about concussions? What are the causes and symptoms of one? When should you seek medical attention? These are just a few of the questions Cranium Crew has worked to answer. Originally focused on skiers and snowboarders, Cranium Crew uncovered concerningly high rates of suspected concussions that went untreated. Initial surveying showed that 20% of skiers and snowboarders thought that they had an undiagnosed concussion. Further surveying indicated a general lack of knowledge about concussions, as well as some common misconceptions. Therefore, Cranium Crew was created to help raise awareness about concussion symptoms, causes, and when to seek medical treatment. So, what does a Cranium Crew education session look like? These educational sessions were open to anyone interested and included a presentation for approximately 30 to 40 minutes. The presentation contained information on who is at risk for a concussion, how concussions occur, the immediate symptoms of a concussion, long-term complications, and general advice about when to seek medical treatment. This was followed by 3 case studies to help develop talking points when addressing concussions with others. Lastly, survey information was then collected, asking about participants' confidence in their own knowledge about concussions, whether they would seek medical treatment themselves, and their comfort speaking to others. These graphs show a portion of the collected survey data that highlights some of the most important educational goals of Cranium Crew. Participants estimated their knowledge of concussion causes and symptoms on a scale of 1 to 10. Each bar's height is associated with the number of survey responses for that corresponding number. The blue indicates participants' estimated knowledge level before the program, while the green indicates estimated knowledge level after the Cranium Crew education. What we see is a dramatic and statistically significant shift of responses towards the higher end of concussion knowledge. When we look at participants' confidence in speaking to others and willingness to seek medical attention themselves for a suspected concussion, we continue to see the same statistically significant upward trends. As before, the blue indicates before Cranium Crew and the green indicates after the education. With these results in mind, the initial data analysis of Cranium Crew's effectiveness strongly indicates increasing concussion knowledge and comfort when approaching others about symptoms. In addition to providing educational presentations, Cranium Crew helps supply the local ski patrol with informational handouts to give skiers and snowboarders if they are concerned about having a concussion or just want more information on the topic. While the effect of these handouts cannot be directly measured, it is another way Cranium Crew has helped spread information about concussions. Ultimately, I think Cranium Crew was a success, both statistically and emotionally. Cranium Crew was an excellent opportunity for me to learn more about concussions myself and to help spread that information to my local community. I think there's still a lot of room for this project to continue to grow. Providing more education sessions would continue to increase concussion awareness in the central Wisconsin area, as well as continue to validate it as an effective means of concussion education.